Welcome to COVID Talks. Today I have with me Dr. Tony Bartone. Dr. Bartone is family physician in Melbourne, Australia. He is the president of the Australian Medical Association and member of the World Medical Association Council. Good evening, Dr. Tony Bartone.
Good evening, Omar.
Tony, so far the number of detected cases in Australia with an intensive testing in Australia is still relatively low, close to 6,000 cases. Unfortunately, there have been about 46 people dying of COVID-19, but yet the number is pretty low. And still, your country is discussing even going into harsher measures into restricting the spread of COVID-19. So what is the situation right now in Australia?
Thank you for the opportunity to talk to all our members across the world. But Omar, look, it's really important that we're in a unique situation where we were able to see on our television and on our news screens what was happening in all the other parts, in the Northern Hemisphere in particular. And that did sort of gel us into action and prepare and plan in a much more prepared way, and with the opportunity, with the luxury of a bit more time. And thereby what we've really been doing is really ramping up our capacity and our preparedness for any eventuality of the scale that we're seeing played out in Italy, Spain, North America now as we speak. So essentially, it's been about ensuring that we have sufficient PPE, personal protective equipment. It's about ensuring that we've got the scalable resource of increasing ICU and ventilator beds, because clearly where we were, say, a month or two ago was at 2,000, and even in the best modelling, we would need to have 7,000 or so beds available, even in the best case scenario. So clearly we needed time to scale up and form partnerships and increase bed capacity and bed both in typical ICU situations and indeed other operating theatre situations. We've brought our elective surgery to a halt. We've scaled up respiratory type clinics in general practice and primary care, and it's all been about limiting the social distancing, the social movement by social distancing measures or physical distancing measures. It's been about ensuring that we have that communication campaign and taking the public on the journey, because even still now, as we speak, with the relatively lower numbers compared to the rest of the world, a lot of the population are saying, is the cure in terms of the economic consequences worse than the disease? And so there's this real constant struggle and tension between economic and business interests, which are seeing relatively low numbers versus what we're seeing played out on our TV screens. So really, essentially, we're playing a waiting game. The best case modelling still shows us having a peak somewhere in July or August. The worst case scenario, if we didn't take on any of the measures, which included closing the borders, quarantining of return travellers back to Australia, of the social distancing measures, and also the enhanced testing capability, if we had none of those in place, we would have been looking at an earlier peak of May and probably several-fold the pressure on intensive care resources than we had. So that's where we're at. We have very empty hospitals at the moment because they've been cleared out in anticipation, but waiting for an invisible enemy to present. Forces are being mobilised. PPE is additionally being sought in a very global constrained market of supply, and also we're limiting that spread. And just today, the Victoria, the southernmost state of Australia, has decided that it's going to close its schools relatively close its schools by making them only for children of essential services. The rest of the population is expected to stay home and school from home over the internet for the next 3 months. The rest of Australia hasn't taken it that far, but we have no mass gatherings, we have no sporting fixtures, all of those things which we would have expected to be commonplace in the kind of setting that we are at the moment. So very interesting times, very difficult times. We've seen these images that I know are being replicated all over the world in terms of massive social upheaval, unemployment, businesses closing, enormous economic stimuli by the government, 6 months support of job seeker and job keeper programs, so keeping workers in occupations by essentially paying a minimum salary to guarantee to all those businesses so that they don't have to lay off staff. One thing's for sure, whatever the consequences of health, we'll be having a very long and difficult economic conversation for many years to come over the enormity of the debt that's been sustained.
So flattening the curve is the first aim here that you have, like in most other countries that we have spoken to. But for you, for Australia, that means the curve will be very flat and it goes very long into the year, probably much longer than those countries which now having springtime and going into summer. So what does that mean for the normal illnesses and diseases, which you're still seeing? And I guess that puts a different time onto primary care, but also on the hospitals, which still need places for strokes, heart infarcts, and broken legs.
Look, absolutely, very good point you make. And indeed, just today, I've had a conversation with our health minister, and we're having a very coordinated series of presentations and media over the need to ensure that regular healthcare continues as needs be. Otherwise, all we're doing, because we're looking at least 6 months of this or more here in Australia, we're essentially going to really have a huge burden of care being deferred into the future with significant complications and reduced outcomes. So that's our focus now. In fact, primary care and general practices are extremely quiet facilities. We have a very large transformation in terms of telehealth now. So virtually 80% of our work is being done through a telehealth medium, phone or video, and foot traffic is very low, and that's a worry. People are putting off their care because of fear, worried that they might catch COVID if they go out, or they shouldn't be bothering doctors when they're very, very busy with a really large epidemic. And we're trying to redress that. Of course, I mentioned public hospitals are empty, and all the non-acute surgery has been virtually brought to a halt. So a lot of that, what we call lower acute surgery, is going to become semi-urgent or urgent if not attended to very soon. So we're really staring at a number of issues. And the only thing that's going to speed up the next 6 months for us, the only thing is a vaccine. It's only then that we have a true exit strategy, because otherwise, with extremely low levels of herd immunity in the population, we can't begin to open up our borders. We can't begin to start the process of social mobilization again. So, there's been theories talked about having a slow burn, progressively, allowing more and more of the community to spread and having small, lesser amounts of herd immunity grow to a baseline of 60 or 70%. But given we don't know enough about the virus, we don't know whether you are significantly protected from getting a second attack. These are all the issues in play. And so really the only effective thing at the moment is that the only effective solution is a vaccine. And hopefully, I know it's 12 months is the suggested time frame, but if we can get something towards the end of the year, we can start to really relax. But I think we might relax some of our measures internally, but I think our borders might be a hard border for a long while to come.
That is really a long-ranging perspective for fighting COVID disease. Now, for a couple of weeks, that may be easy for families, for people to swallow and to stay on distance. Do you expect then that there will be effects on mental health, on the psyche of people, being distant for such a long time?
Absolutely, another good point you make there, Otmar, and that's exactly the focus of a lot of activity. We had a mental health strategy which was going to be for the next 10 years implemented sometime in the middle of this year. Now that's been put on hold, but the entire resources and supporting materials for that have been allocated to the short term, the medium term and the long term effects of COVID, because clearly they're going to be enormous, not only from an economic and a dislocation point of view, but clearly, as you point out, transforming your lifestyle and being at home essentially 24/7 is going to take huge tolls, especially we're limiting our spread. We're talking about our elderly, those over 70, being at home and not seeing visitors, not even family visitors. We're talking about 60-year-olds with chronic disease doing the same thing. And for 6 months, that's an enormous strain on that. Our infrastructure in terms of our network broadband is surely not up to the task, I would imagine, for everyone to work from home and school from home, and notwithstanding all the other activities that go into staying at home. So we've got an enormous amount of work and ensuring that our economy remains afloat into the months and years ahead.
Dr. Bartone, it looks that we will have another talk down the road during the year, because it will be a longer exercise for you, probably longer than in other countries.
And Otmar, I'll share, just today we've released a modelling that the government's relying upon. It's theoretical, it's based on Northern Hemisphere data. Of course, we'll update that once we get our own local data, because really with only 6,000 cases, we don't have enough data to actually prognosticate a model on. But the other thing is that fortunately, we've been able to test nearly 300,000 population, and that is per capita one of the highest rates in the world. So hopefully we'll have some more updated data for you when we next talk.
Thank you for now for this talk, and have a good evening.
Thank you.